Welcome to our slideshow of Pediatric Dentistry. My name is Jake McCrae and I will be presenting along with Jennifer Bassett, Megan Butler, and Justin Matthias. The first question I want to go over is, what is pediatric dental care and what does it include? Pediatric dental care is oral care ranging from newborns up until 18 years of age. Dental care includes tooth decay, and tooth decay is when carbohydrate-rich foods such as candy, cookies, soft drinks, and even fruit juices, and starchy foods such as breads, potatoes, rice, and pasta leave deposits on your teeth, and these deposits bond and combine with bacteria that normally survive in your mouth and form plaque. And plaque forms acid that could damage the mineral structure of the teeth, resulting in tooth decay. Sensitive teeth, over time, tooth enamel can be worn down, gums may recede, or teeth may develop microscopic cracks, exposing the interior of the tooth and causing irritation to nerve endings. Bad breath, poor oral hygiene, gum problems, or dry mouth can lead to bad breath. Grinding is considered to be a normal developmental stage in children. Many children tend to eliminate this habit as they age. Grinding can cause wear on primary and permanent teeth. Dental anxiety, gum disease, gingivitis or gum disease is the inflammation of gum tissue often caused by poor oral hygiene and plaque formation. And gum disease can lead to tooth loss and bone damage. In the early stages, it can lead to bleeding gums and your gums become red and swollen. Canker sores, small sores inside the mouth. Over-retained primary teeth. It's when a primary tooth is in the position when a permanent tooth is trying to erupt in the same space and requires removal of the primary tooth. Wisdom teeth is when your wisdom teeth grow in at certain angles or your mouth does not have room for them. It requires extraction. Orthodontic care is caused by missing or extra teeth, crowded teeth, or misaligned jaws. Also, accidental or developmental issues such as finger or thumb thucking can occur, and that can misalign your jaw. Okay, the next question I want to address is, what is the problem and why is it a problem? Dental care is the most widespread unmet healthcare need of children in the United States. Tooth decay is the #1 childhood chronic illness affecting young children. Dental care can cause pain, infection, problems in your children's growth, eating, speaking, and learning. Severe decay can have serious consequences for children's speech and jaw development. Dental disease has been linked to bacterial infections, heart disease, stroke, diabetes, pneumonia, and even death. Here are some pictures of tooth decay. On the top left, you'll see normal, healthy teeth. Top right is when your teeth start to decay a little bit. The enamel gets eaten away. And then in the bottom left is when dental caries or cavities start to form, and then severe decay on the bottom right. Now, causes of dental disease. The #1 cause is poor oral hygiene habits, not brushing your teeth, not flossing, not taking care of your mouth. That in turn causes an excess of plaque formation and bacteria in your mouth, which tend to break it down. Illnesses also can cause dental disease. Diabetes. People with diabetes have a higher risk of developing infections, including gum disease. There's other illnesses such as AIDS and its treatment and cancer and its treatment that can also negatively affect the health of gums. Certain medications, there's hundreds of medications that are over-the-counter and prescription that can reduce the flow of saliva, which has a productive effect in the mouth. Without enough saliva, the mouth is vulnerable to infections such as gum disease. There's also some medicines out there that cause abnormal overgrowth of the gum tissue. This can make it difficult to keep teeth and gums clean. And then also family history. Some families, some people just tend to get more dental diseases if their other family members had it. Smoking, obviously the smoke can damage the teeth and gums, and thumb sucking can cause misalignment if children keep doing it. Healthy People 2020 is a set of goals and objectives with a 10-year target designed to guide national health promotion and disease prevention in the United States. Here are some of their goals that target pediatric dental care. Reduce the proportion of children and adolescents who have dental caries in their primary or permanent teeth. Reduce the proportion of children and adolescents with untreated dental decay. Increase the proportion of school-based health centers with an oral health component. Increase the proportion of local health departments and federally qualified health centers that have an oral health program. Increase the proportion of children and adolescents who have received dental sealants on their molar teeth. Increase health agencies that have a dental public health program directed by a dental professional with public health training. Now, who is affected? Approximately 17 million children in America are without dental care each year. Only 1.5% of 1-year-olds have had a dental office visit, whereas 89% of 1-year-olds have had an office-based visit with their physician. Over 25% of children aged 2 to 5 and 50% of those aged 2 to 15 are affected from tooth decay. 17.5% of children ages 5 through 19 years are with untreated dental caries. More than 51 million school hours and 164 million work hours are lost each year due to dental disease, leading to increased educational gaps and decreased productivity. Children from poor and racial ethnic minority families have higher rates of untreated dental caries than their peers from middle class and majority families. Here on this graph, towards the bottom, you can see that untreated dental caries from ages 2 to 8 years old are almost double in non-Hispanic Black and Hispanic than from non-Hispanic white. Now, the impact on economics. Approximately 43% of Americans are without dental insurance, including more than 20 million American children. This is almost 3 times more than the population that lacks medical coverage. For every $1 spent on preventative measures for oral health, American taxpayers have saved up to 50 in restorative and emergency procedures for the under and uninsured. Now here's a list of average costs of dental care without insurance. And as you can see, if you're a low-income family and you do not have dental insurance, these costs can be very hard to pay. Typical exam x-ray cleaning ranges from $120 to $300, cavity filling $70 to $180, tooth extraction $180 to $600, crowns $1,100 to $1,300, and root canal $700 to $1,400.
All right, so my name is Jennifer, and I'm going to be talking about legal issues, ethical concerns, and varying cultures, and how they impact pediatric dental care. So the first thing I just want to go through here is the Centers for Disease Control and Prevention really talk about how tooth decay is one of the most common chronic conditions in childhood in the United States. And it's important for us to take care of our children's teeth because it can lead to other problems in their development, like eating problems, speaking problems, playing and learning issues. As a mom, I went through the frequently asked questions page of the American Pediatric Dentists, and I found just a couple things that stood out to me. One is we should be taking our children to the dentist for their first checkup when their first teeth come out, or no later than their first birthday. That's what's recommended. Also, babies' teeth are really important to our children because our primary baby teeth are going to make a pathway to our adult teeth there. So they do affect our adult teeth. And I also read in the American Pediatric Dentists that if you have more cavities in a child, then it can cause you to have more cavities in your adult teeth there. So it does affect our adult teeth, and they are important to take care of. And our visits for our children should be every 6 months is what's recommended there. So those are just a couple things that I wanted to go over because I had some questions about how to care for my little son's teeth. So let's go into the issues we have here. So legal issues that impact children's access to dental care because of expense. So the big issue is that dental coverage is usually not covered in our insurance policies. And I know this makes a big barrier because a lot of people don't want to have to pay into an extra expense to get their dental coverage. And if we don't pay into that extra expense, then we're having to pay out of pocket for dental visits and stuff for our children. So it can be very expensive. That's a big issue there. With ethical issues, a lot of the times children are uncooperative. They don't want to go to the dentist, or they're scared of the dentist. And this can make a big concern, especially for a parent. It can be stressful and just not fun. So what do we do? The American Academy of Pediatrics said that parents, really, we as parents exert a lot of influence on our child's behavior. If we get really annoyed and overwhelmed with taking our child to the dentist, or if we have had bad experience at the dentist and we get anxious, it can really rub off on our child. So it's just important to be as calm as we can and as positive we can about the situation, and that will help to influence our child to have a more positive experience at the dentist. It doesn't always make them have a perfect experience, but it can help. So cultural issues here. So a lot of people say, you know, my parents never took me to the dentist, or in my culture or where I grew up, no one went to the dentist, or people just went to the dentist when things got really bad. That's one issue that we just need to overcome. We need to overcome having feelings like our children's teeth don't matter, because as pointed out in my slide earlier, the CDC, American pediatric dentists, are telling us, we've done research, we've gone through these things, it's important. Their children's teeth are going to make the pathway for their adult teeth, and it can influence the way their adult teeth are when they're older if we don't care for them as children. So it really is important. So we need to just get over these cultural issues and barriers and try our best to take care of our children's teeth. And maybe just a reminder, like this presentation is all we need. Oh yeah, we do need to go in and get those checkups. So, and sometimes it may be a language barrier, like this says for foster care children. It shared that a lot of people avoid communication with their dental staff, or don't go to follow-ups because they don't have good communication with their dentist because of a language barrier. With this, we'd have to do research, try to find a place where they have Spanish speaking, or whatever language that you're needing, or translators. So sometimes it just takes a little research on our part, and I know that's difficult. Resources we have here. So I have a local resource in Rexburg and Idaho, but I know not everyone's in Idaho. For example, locally there's a place where they give free x-rays, exams, and fillings and extractions. And I can promise you that every area, it might be a drive to get some kind of help like this, but if you go to your public health department, wherever you may be, they'll have some sort of program or help for you and your children's dental care. So I would definitely put a plug on that. I just went the other day to our public health department, and they were sharing something with me that is a sliding scale for the patients of this certain pediatric dental place. So a sliding scale means that you go in there and they're going to pay you a certain amount depending on how much you make. So that could help reduce that issue with those legal concerns of insurance not being able to cover our dental coverage. So federally, they also have Medicaid and CHIP. And Medicaid and CHIP can cover our children up to 19 years old if you're low income. And a lot of people do not know that, which is So I really want to hammer that home. If you have Medicaid, your child has dental coverage. And a lot of people don't know that. So just if you do have Medicaid, look into that. And also, that's only for low incomes as well. So now, my last little thing here is just I want to say that our children are relying on us to take care of their teeth, especially our infants. I mean, we need to care for them the best that we can. And as soon as those teeth erupt and that first year, let's get them into that appointment. And let's overcome those cultural, legal, and ethical issues that may arise in our lives to really take care of our children so they can be happy and healthy. I wish I could talk more about this, but we'll go on to the next presenter here.
Levels of prevention include primary, secondary, and tertiary. Dental care can provide all these levels of prevention for pediatric patients. The first level of prevention is primary prevention. Primary prevention will work to prevent disease from occurring, such as in the prevention of cavities. In primary preventative care, dentists will do routine checkups that include x-rays and dental exams. Part of these dental exams include removing plaque from teeth with special tools and giving fluoride and cleaning treatments. Dentists can teach parents and children how to properly clean teeth, including proper brushing technique, flossing, and which products to select for best dental care. Educating patients to perform these things regularly is one of the most important parts of the teaching. These providers should also teach parents about baby bottle tooth decay, which can be prevented. Baby bottle tooth decay occurs when infants are given milk or sugary drinks in a bottle, especially at nap or bedtime, which allows sugars to cling to the teeth. This then allows for the growth of bacteria because there is a decreased amount of saliva during sleep. With the sugar sitting on the teeth and decreased saliva production, the bacteria can easily grow where the sugar rests. To prevent this from occurring, avoiding sending your infant to bed with a bottle, wiping the gums with a clean washcloth after each feeding, and brushing the infant's tooth without toothpaste can help. For infants, if you choose to use toothpaste, choose a fluoride-free toothpaste. Continue regular visits with the dentist and consult with him or her with any concerns, and doing so can help prevent oral problems. Regular dental visits should be established by the child's first birthday. Encouraging the reduction of sugary food and drinks in general will help maintain oral health, and including a healthy, well-balanced diet will help teeth to become strong and remain healthy. Next is secondary prevention. Secondary prevention includes early intervention in finding problems at an early stage so that the problem can be managed. Screening for dental caries or cavities will help detect these cavities at an early stage before they affect too much of the tooth. Dentists and healthcare providers will also check the mouth and feel around the neck and jawline for signs of changes, such as possible cancerous growth. Checking the oral cavity and gums for inflammation and other signs of gum disease will help detect problems early on so that interventions can be implemented to delay or stop the disease. Finally, there is tertiary prevention. Tertiary prevention occurs once a disease has developed and focuses care on reducing or minimizing the effects of that disease. With tertiary care, the hope is to eliminate complications and furthering of the disease. Most of the time, medical interventions fall under this category. This is because most people seek medical care once they display signs and symptoms of a disease. The dentist will fill dental caries before they grow too large to prevent the spread of the cavity to the roots, which could kill the whole tooth, leading to a much bigger problem. Tooth extractions and root canals are also part of tertiary prevention. Also, the filling of gaps with tooth implants will help a person's eating and alignment. The use of dentures and bridges can also help a patient who have missing teeth. All these are done because a disease process has occurred, and treatment of these things will help a person to live a better quality of life and also to prevent premature death. All levels of care can give a patient the confidence they need because they maintain a healthy smile. Our oral care can affect many aspects of our life, and as always, prevention is the best intervention. So, why does intervention matter? With pediatric patients, parents may think that dental care is not completely necessary because their teeth are going to fall out anyway. However, proper dental care can prevent pain for the child. If a child experiences pain with their teeth, this may lead to other issues such as problems with speech and inefficient nutritional intake. Children are in a time of crucial development as they set their speech patterns. Pain in the mouth may delay or cause problems with their speech. They may also avoid eating certain foods or food in general because of the pain. Also, their baby teeth are placeholders for their permanent adult teeth. Healthy care of baby teeth will set patterns of care for the adult teeth as well. Not taking care of a child's teeth will increase the risk of adult teeth coming in crooked. Taking care of your child's teeth will ensure that they do not have discomfort and that they do not need to remove decayed teeth that could have potentially been prevented. With a healthy smile, children can continue to be themselves as they grow into adulthood.
This is Justin Matthias, and I'll be covering the nursing process in our presentation of pediatric dental care. The nursing process is a common tool used throughout different types of nursing. Nurses who work in varied areas, and it's a general tool that we can use to assess, diagnose, plan, implement interventions, and evaluate those interventions as well. The first step in the nursing process is assessment, and relating to the pediatric dental care, it's important to be able to recognize the two different factors in your assessment, one being a healthy oral mucosa, and second being altered oral mucosa, and what signs and symptoms are related to that. For healthy oral mucosa, the first one would be inflammation, no inflammation, that there's no swelling noticeable, that the gums are pink and moist, that you don't notice any lesions, or that the gums and skin inside the oral cavity is intact. The child isn't reporting any dryness of mouth that is commonly occurring, or any pain. That can include pain in a localized area of the mouth, or any ability to swallow with no discomfort. And any symptoms of an altered oral mucosa could be cracks in the corner of the mouth, could be related to dehydration, reddened or retractive gingiva, retracted from the distal part of the teeth. Dysphagia or any painful swallowing, dry mouth, again related to dehydration, or any reports of pain, again could be localized or painful swallowing. The second portion of the nursing process is nursing diagnosis. And according to NANDA nursing diagnosis, this would be altered oral mucosa. And altered oral mucosa is the state in which an individual experiences changes in the tissue layers of the oral cavity. As nurses, it's important that we are able to discover what is the factor that is impeding the child to have a healthy oral cavity. We need to recognize that and be able to implement interventions to avoid that thing that is preventing them from having a healthy oral cavity. And again, the altered oral mucosa is a general diagnosis, but it could be related to more specific factors such as dehydration, malnutrition, oral hygiene ineffect, or a pathological condition or infection. The third step in the nursing process is planning, and this includes two portions. The first portion being a short-term goal and the second portion being a long-term goal. A short-term goal is going to be implemented right away. Could be encouraging cleaning of the mouth frequently, or having any areas that are broken down or teeth that have chipped or broken to be repaired, and a referral to a professional may be necessary at that moment. To teach, another short-term goal would be to teach the child proper techniques of brushing teeth, rinsing, of flossing, or any other techniques that would be necessary to encourage a healthy oral cavity. And also that we will teach them any habits that they have that could be impeding their health, that they stop these habits. It could be anything from having more food after they brush their teeth before bed, or taking juice to bed with them. Long-term goals would be to educate parents or guardians to encourage the child to have oral hygiene, because depending on the stage or age of the child, they will have a large impact of their oral health. And again, depending on the age of the child, they could understand the importance of oral hygiene. So also important to educate the child, him or herself, to continue to perform oral hygiene, and that they can understand the risks and benefits of that. The fourth step would be the implementation of any interventions that you have planned. Again, this could be the basic oral hygiene, just that common routine, especially after meals and snacks and before bed. Important to use a soft tip toothbrush to protect the gums, so that any rigid areas of the mouth won't be too damaged by the toothbrush or by the oral care that the child is implementing. Frequent mouth rinsing, and not necessarily needing a solution high in alcohol, but could be starting with a warm saline or a mixture of baking soda, water, and salt that can begin the process of healing. To encourage adequate fluid intake so that it prevents dehydration, it keeps the mouth moist, and encourages healing. And again, if necessary, needing to refer to an appropriate healthcare provider, depending on the severity of what is needing to be healed at that moment. And the last step in the nursing process is the evaluation. It's important that we as nurses don't necessarily evaluate our interventions that we have planned, but more that we evaluate the patient, him or herself, because these interventions could be successful or not, the child could be brushing his teeth daily and according to what we had planned. However, it is not taking the effect that we need. Therefore, we need to be able to evaluate the patient. And if it has been meeting our goals, obviously we encourage in that same plan of action. If not, it's important that we take the step to change our care plan and even our goals if necessary if they have not been met in order to have success in their oral health.
Preventative dental care for pediatrics includes many different responsibilities. This includes proper nutrition and dietary habits, fluoride treatment such as getting drinking water with fluoride added, regular brushing and flossing, regular dental checkups, and becoming educated on oral care. The dentist can also assess risk for developing cavities, evaluate oral growth and development, and apply sealants. Also, protecting the mouth against injuries and guidance of erupting teeth are part of preventative care. A dentist can do a complete oral exam on your child. What does this include? This looks at the general health and growth of teeth, assessment of any pain, examination of soft tissue outside the oral cavity and inside, and also the hard tissue inside the mouth, looking at the temporomandibular joint, which is the joint by the cheekbone that controls jaw movement, and look at any developing occlusions. The dentist will look at the oral hygiene and periodontal health of the child as well as the risk for cavities, and also look at the behavior of the child. Dentists can also begin cleaning and give fluoride treatments to children. Sealants are applied to help prevent tooth decay, and they also can provide early intervention and diagnosis of tooth and orthodontic issues. So, what can parents do to help? Parents are an important part of oral care for their children. They can establish good habits in the home by keeping routines and following dentist's recommendations for brushing, flossing, and diet. Also, parents should choose the correct toothpaste and other oral care products. Dental care begins with the first tooth, and regular dental visits should be made by the child's first birthday. Doing this can prevent dental disease and cavities. And, as always, prevention is the best measure of care. Dentists can also begin cleaning and give fluoride treatments to children. Sealants are applied to help prevent tooth decay, and they also can provide early intervention and diagnosis of tooth and orthodontic issues. So, what can parents do to help? Parents are an important part of oral care for their children. They can establish good habits in the home by keeping routines and following dentist's recommendations for brushing, flossing, and diet. Also, parents should choose the correct toothpaste and other oral care products. Dental care begins with the first tooth, and regular dental visits should be made by the child's first birthday. Doing this can prevent dental disease and cavities. And, as always, prevention is the best measure of care.